The Office of Health Standards Compliance and Health Ombud is briefing the media on the release of the findings of the risk-based inspection and investigation into the allegations against the Helen Joseph Tertiary Hospital. Let's take you live to that.
Above all, I would like to welcome Thomas Holmes, otherwise also known as Tom London. Welcome, sir. Without you, we wouldn't be here. And then we should welcome all the members of the media and other ladies and gentlemen that have got no categories among the ones that I have mentioned. Now, first of all, I'm going to be presenting a summary only of the report, and the full report is going to be on the Health Ombud's website, which is shown there on the slide. The investigation was prompted by video recordings placed on the public media by Thomas Holmes in September of last year. Excuse me. The Health Ombud was, as a background, the Health Ombud was established by and derived its powers from the National Health Act as amended. The Ombud is an independent and impartial office within the Office of the Health Standard Compliance. The Ombud may investigate complaints lodged in his office, or may initiate in his own accord investigations on alleged apparent infractions against norms and standards of health provided by health establishment. The Act implores the Health Ombud to execute his functions in good faith, without fear or favor, bias or prejudice. Now, the investigation methodology that was followed is that after Tom London made several allegations against the Helen Joseph Tertiary Hospital, the Office of the Health Ombud followed the established methodology to investigate these allegations. I must say that while we were starting our investigation on our own accord, while we were preparing that, the Minister of Health, Dr. Aaron Motsoaledi, also asked the Health Ombud to investigate. So we might as well say that we had a two-pronged investigation in that way. Now, the methodology involved interviews with Thomas Holmes. We interviewed the hospital's management officials and professional staff. We inspected the hospital, and we inspected the hospital facilities, not only where Tom London was accommodated, but in other parts of the hospital to assess the generality or otherwise of the problems that he was experiencing in the ward. We interviewed senior Gauteng Department of Health officials, and this presentation will therefore focus mainly on the clinical aspect of the report, and the details of infrastructure and human resource and governance will follow and will be dealt with by Dr. Mdaweni, who is the CEO of Office of the Health Standard Compliance, and her report follows the risk-based inspection that the OHSC undertook following this video flighting. Now, what I'm going to do, I'm going to take you through the allegations, the substantial allegations as we saw them, and the findings thereupon. And the numbering is irrelevant. It doesn't in any way impart the importance or lack thereof of the allegations. They're simply numbered for convenience. Allegation number one is that Thomas alleges that he spent 3 days in the emergency department owing to the unavailability of a bed in the medical wards. Our finding is that this was substantiated, and it is in fact constitutes a breach of one of the regulations, being regulation number 22 of the norms and standard, which implores that the health establishment should monitor waiting periods so as to avoid inordinate delays. And then allegation number two is that doctors disrespected patients and treated them like cockroaches. The findings are that this allegation was not substantiated. Interviews with patients who were in the same hospital ward as Mr. Holmes disavowed this allegations. And the only significant finding, which does not in any way sustain the allegation, is that one Dr. JTG, against whom Mr. Holmes specifically complained that she did not acknowledge him when the doctor was perusing his medical records. The doctor explained that she did not want to disturb the bedside tutorials that was being given to medical students at the nearby bed, and therefore just went and consulted the notes instead without greeting him. And then number three is that the X-ray staff forgot to administer radio contrast medium, what Mr. Holmes calls a dye, during the initial CT scan. The findings are that this was not substantiated. It is important to note that the clinical doctor who was responsible for the patient had ordered an uncontrasted scan as per the routine in similar cases. It was only when the radiologist had examined the CT scan that the radiologist found it necessary that a contrasted scan should be done, and this was done on the same day. Allegation number four is that Mr. Holmes says that he was not attended by any doctor for 48 hours while in the ward. What we did find was that Mr. Holmes was examined daily for a total of 23 times by different doctors during his admission to the ward. This excludes the examinations and treatments that he received in the 3 days that he spent at the emergency department. And number five is that Mr. Holmes was provided with poor clinical care. This allegation was unsubstantiated. Indeed, Mr. Holmes received appropriate management and treatment for his pulmonary condition, but he declined further surgical treatment at the hospital, for which he preferred private hospital treatment. Indeed, during an interview with Mr. Holmes, he stated that he does not look at the clinical care he received at the hospital as inadequate. Indeed, he was full of praises for the hard work of the nurses that were looking after him, and indeed praised the treatment he received from some named doctors. Number 6, there's a poor hospital infrastructure. The findings on this allegation is that it was sustained. There was peeling paint from the ceilings and walls. There were broken basins and taps. There were non-functioning electrical plugs, and there was a poor supply or flow of water to the wards beyond 7th floor because of the weak pump that was pumping the water. Over and above that, there was another allegation, number 7, where he alleged that a corpse was left in the ward unattended for hours. This allegation was not sustained. We found that the patient was certified dead at 6:30 in the morning. The times don't matter, and then the corpse was logged in the mortuary 2.5 hours later. Now the hospital has got guidelines about dead bodies, and that a body may not be in the ward for longer than 2 hours. And it should also be noted that it is a general rule that bodies must be left to cool before being washed and draped for transport to the mortuary. Indeed, if people hurry to take bodies to the mortuary, as it had happened in the past, the bodies were not corpses. There were people who when they get to the mortuary, they wake up and then they shout and want to be opened up, and often there will be nobody to open for them. So it is important that people should not be, rather corpses should not be taken in haste to the mortuary. Apart from the complaints that Thomas raised, the investigation found some additional problems there. And firstly is the human resource and human resource management. The HR department is completely dysfunctional. There was poor working relationship between the HR manager and some of their subordinates. There was a general breakdown of authority within the HR management. There's lack of stable senior permanent professional management cadre. Most senior posts, including that of a CEO, are occupied by acting personnel. There's lack of governance in general. The people and departments, they function in silos. There are no policies or standard operating procedures, written ones, in the hospital. The temporary senior managers have been recently, some temporary senior managers have been recently seconded to turn things around. That was before we got there for the investigation. I should so that you have a context, is that there had been a complaint by the staff about the situation in the hospital to the department, and the department then took a number of senior managers from other institutions to go and stabilize this Helen Joseph Hospital. And the next finding pertains to the support services department. The hospital linen management is very poor. There's no inventory management system at all. And soiled and dirty linen are left to pile up at the hospital before being transported to an outside laundry. And this is a major issue. And because of lack of inventory, is that the hospital doesn't know what has been sent to the laundry, doesn't know what has come back. As a result, there's shortage of linen, and patients have to lie in bed without clean linen. The other problem pertains to security. It is security is inadequate, and the security that is there has got a laissez-faire attitude at the entrance and exit points. And there's also a shortage or non-delivery of certain foodstuffs. And this is occasioned by the fact that several service providers, they go unpaid. In other words, their invoices, they either they are not paid altogether or they're delayed. And C is the staff shortage. The hospital still functions on an old regional staff establishment long after the designation, or its designation as a tertiary hospital. However, 30% of the old staff establishment still lies vacant. Particularly, it affects the nursing staff. A number of resignations have been snowballing within this cadre, especially at the emergency department, because the emergency department was being revamped, and when it was being revamped, it was relocated somewhere, and the accommodation there was not conducive, and a lot of nurses did not like that arrangement, and they resigned. As they resigned, those that are left behind, with the workload, which was extreme in the first instance, became even worse. Now, the next area of concern was the finance and supply chain management. There's no clear separation of duties within the finance department, and therefore that makes it risky, not only about the non-payment that we've already alluded to, but also that maybe wrong payments may be sent to the wrong supplier. That's a polite way of saying that there might be corruption. Staff members are not suitably qualified as far as we could discover. And what are the recommendations? I can see here, but I see it doesn't see you. But anyway, I'll continue reading until it gets there. We make the recommendations firstly to the Gauteng Department of Health, and then the other set we make recommendations to the hospital itself. If we start with the Gauteng Department of Health, we say that the Department of Health must review the staff establishment to align with the tertiary hospital function that the hospital now has been gazetted to do. There should be filling of vacant posts even within the current staff establishment. I already told you that there's 30% vacancy even following the current staff establishment. And within that, we say that the Gauteng Department of Health must prioritize the CEO and senior clinical posts. It should address the leadership and management problems, and therefore we recommend that they should appoint an independent auditor to assess the competency of the current leadership and staff and management staff, and then upscale and retrain those management staff that require such training and upskilling. About infrastructure, there should be refurbishment. They must prioritize infrastructure refurbishment, e.g. the sewer system and the water supply. And then they should get resident artisans to be appointed at the hospital to carry out ongoing maintenance work. It is the fact that currently there are no artisans that are resident there. They get seconded on a day-to-day, week-by-week to the hospital by the Department of Infrastructure Development. And the hospital itself doesn't have resident artisans. And this is a major defect in our judgment, and which is very simple to ratify. And lastly, they must reclassify the community health centers to district hospitals in order to take off the slack from this tertiary hospital that Helen Joseph is.
All right, that is the Office of Health Standards and Compliance and Health Ombud giving a briefing around its investigations into the Helen Joseph Hospital, some of its findings, and it's come out with some recommendations.